what is acidity? The name acidity people think that it is a disease related to acid. We all know that stomach produces acid for the digestion of the food substances we eat. And when this acid makes its way into the food pipe, that is retrograde fashion, it is unusual for the system to handle that matter. So people experience little bit of a discomfort or a heartburn or some sort of a pain in the chest when it happens. But some amount of acid entering the esophagus in a retrograde fashion is common in a normal situation. When it becomes abnormal, that's the time when you start experiencing all these symptoms. Is it that acidity, what we mean, always due to the so-called acid we are mentioning, that is the stomach acid coming up to the food pipe? Not necessarily. The same amount of acid-related discomfort, what we experience as heartburn, chest pain or discomfort, may actually be a part of a heart disease, a gallbladder disease, or it could be unrelated to the stomach or even heart. It could be lung disease, or it's simply a part of expression of the stress. So all people experiencing so-called acidity not necessarily be suffering from acid. That is the basic thing we all must understand. Is it that not experiencing these things exclude that a person do not have acidity? Again, we need to understand that there are certain atypical symptoms the people experience which they think they are not due to acidity. Say for example, the person may have a soreness of the throat, he may have a change in the voice, or he may have an unusual funny tingling sensation in the teeth. They all may be a part of reflux disease, but unless a specialist interprets these symptoms, the people mistake as these are not related to acidity. So acidity not necessarily mean that the disease has something to do with acid, and at the same time no acidity symptom doesn't mean that a patient may not be having a symptoms. So when do we start be concerned about the acidity? Usually the age-old household medicines like taking some sort of a cold milk or a buttermilk or drinking some cold water, usually make the people subside their acid-related symptoms. But when it becomes persistent or it becomes difficulty in swallowing, or sometimes the patient may experience vomiting of blood, or if there is a difficulty in swallowing, so these conditions make us believe that a stage of disease has advanced. So whenever such symptoms are persistently present, it is the time to see your doctor. Is it that acidity related symptoms can be controlled without seeing a doctor? It is always possible. As I said, the so-called first aid medicines usually work for a limited amount of time. When the symptoms will increase, in spite of these household remedies, the people usually take to the over-the-counter medications like antacids or ranitidine, or even sometimes the proton pump inhibitors like omeprazole, which are easily available in the market over the counter. Then the second stage, the people experience relief with these sort of a second stage medications like an antacids and other oral medications. But if a person requires such medication continuously for a long time, or the patient depends for his relief on a continuous supply of these medications, again it's a time to see the doctor. Of course, I mentioned that whenever the symptoms, like we call it as a red flag signs and symptoms, like you lose weight, or you have vomiting of blood, or you have difficulty in swallowing, there is no doubt that you should see a doctor, because there may be an advancement of the disease of reflux disease, or something else is mimicking like a reflux disease. This is the time to see your doctor. How do the doctors confirm or diagnose the reflux disease? There are simple investigations like an endoscopic examination. It is very simple and it is an outpatient procedure. Usually in anxious patients do get some amount of pre-medication so that the anxiety is relieved, and the examination is over in just half a minute to 1 minute time. Especially it is done in the morning time or any other time which is suitable to the doctor and the patient can be considered at planned. And some other investigations like 24-hour pH manometry or barium examinations are also done as a part of investigation of reflux disease, but there are definite indications for investigations, as I mentioned, apart from an endoscopy. It is a doctor who will decide the need of these specialized investigations to document and diagnose GE reflux disease. So once the diagnosis of reflux is made, a simple stepwise approach for the permanent or a long-lasting relief is the so-called lifestyle modifications. If a person is overweight, this need to be attended to, because obesity or overweight also is a risk factor for perpetuation of the reflux symptoms. If a person is smoking or taking alcohol, or if he is habituated to taking NSAIDs or analgesics or pain-killing medications, these need to be reduced or controlled to a great extent, along with the weight reduction measures. Last and not very important thing is about the dietary habits. These days the people feel that they have no time for eating also and proper meal also. So skipping the meals and skipping a balanced meal replaced by a fast food carry home take away small meals are totally against in the management of reflux disease. You should plan your meal appropriately. Take a balanced meal with an appropriate proportion of carbohydrates, fats and proteins. Never miss a good lunch, good breakfast, and have a decent meal. And preferably a person who is already experiencing the reflux disease should have an early dinner, so that at least 2 to 3 hours of time is available before they go to bed, so that the adequate digestion and gastric emptying must have happened before a patient goes to bed. The second step of management of reflux disease is the use of medications. So majority of the patients do get a significant relief if they have an early stage disease, early stage symptoms with these so-called lifestyle modifications, stopping smoking, taking care of a proper diet, and more important is an exercise and weight reduction. These will go a long way, and there is no question of compromising on these simple and effective measures. The second approach is the use of medication as I was mentioning. The H2 receptor antagonists or ranitidine are usually not very good in managing a reflux disease. So straight away the medication, apart from lifestyle medication, is using the proton pump inhibitor group of drugs like omeprazole, pantoprazole, or rabeprazole, or lansoprazole. These are the advanced proton pump inhibitors. Among these, the esomeprazole and rabeprazole are the preferred group of drugs, because these are the advanced generation of the proton pump inhibitors. These drugs have a lesser amount of side effects, lesser amount of drug interactions, and they are effective in a lower dose compared to the older generation of drugs. Whenever there is a regurgitation or a high volume of gastric contents coming up to the throat or the chest, we usually combine a prokinetic drug like domperidone or etopride or citalopram. These drugs facilitate the emptying of the stomach and also facilitate esophageal clearance whenever the endoscopic grading of esophagitis is beyond grade C or grade D. So when your gastroenterology physician can categorize or grade the disease what you have, he is the right person to use the right combination of these medications and make the symptoms get relieved. Is there any role of surgery in this disease? Definitely, if a person is having a free reflux or a large amount of hiatus hernia, or if the person has a refractory to a particular duration of medication, definitely the surgery also can be recommended, especially young people with morbidity depending upon their clinical condition. Surgery is also a choice. The surgery can be performed through laparoscopic route, which is a very simple procedure. Anti-reflux measures can be simply be employed to that concerned patient. Apart from the reflux disease, we also should remember that there are certain conditions like esophageal eosinophilic esophagitis, or the esophageal symptoms related to allergic lung disease, and certain symptoms related to food allergies also mimic reflux disease. So anything related to the act of swallowing, what you think considered as acid related, or what you think may not be related to acid related, it is your doctor who can help you diagnose and make your life comfortable. Thank you.